Good evening and welcome to Generation Rising Season 2 Wrap-Up. This year, we've explored timely stories that addressed critical issues and celebrated and amplified the voices of our community. Tonight, we'd like to share some of those moments with you and also introduce you to a new segment. We began the season with a story that hit close to home, examining the disparities that many Black and Latino women face in maternal health care. In The Risk of Giving Birth, we discussed the alarming statistics and heard from women in our community who are fighting to bring the disparities to light. Why are women of color dealing with such a high mortality rate in the United States? You mentioned some of those health factors. Can you dive into those a little bit more?
That is a very loaded question.
It could take a long time to get there,
Yeah, it can take
right?
a long time, and please interrupt me and chime in, Keesler, as you see fit. I like to look at it from a more macro systemic view and then dive into the little pieces, because if I knew the answers, then we'd have solutions, right? But it's a little bit of everything. And the number one thing right now, if we're talking about Black maternal health, is structural racism. Like, the United States was built on racism, on enslaved peoples, profiting off of their bodies, profiting off of the Black body, profiting off of the Black woman's body to create more folks for chattel slavery, to create basically the income for this nation, why we are a higher income right now. And the legacy, or I should say the enduring trauma of slavery, has trickled down to what we see today. One thing that I really like to talk about is Black midwifery, or the lack of Black midwifery that exists in the United States right now, and the change from grand midwives in the South and immigrant midwives and Caribbean midwives, in also spanning from the 1800s to 1950s and more, and even now there's a rise in Black midwives coming back into the fold as well. And the changes in community midwives versus what we're doing mostly now, which is certified nurse midwifery, is the biggest group out of all the midwives, and we're mostly seen in the hospitals, right? And we're mostly providing outpatient care in clinics. But the true community midwives, who are the certified professional midwives or the traditional midwives, the numbers are much lower. And I think that piece of community not being there anymore, the piece of you can't access care directly anymore, that you have to go through insurance companies, that you have to go through referrals, that when you first get pregnant, you're not seen here in Rhode Island until maybe even the second trimester, where we've missed the opportunities to talk to you about preconception, which is before you get pregnant, how to get healthy or healthier during that time so that you can have a successful, hopefully less morbidity pregnancy. That's my main focus of looking at this all, is that it's not just right now, but it's what we've done over the hundreds of years of getting rid of community midwives, of structural racism seeping into healthcare, medical bias. All of that has contributed to where we are today. And so that's a much bigger question and a much bigger answer of how can we essentially stop being racist in medicine.
Find a solution to that, right? And you talk about this overall, Keesler, I'll fold you into the conversation, this overall infrastructure that's not serving everyone the same, right? How does that manifest in the work that you do? How does a pregnant person meet you?
So I just wanted to first piggyback off of what Anna said. It is about money. It's always about money, right? So that's how we got the doula bill passed here in Rhode Island, because we presented it to the insurance companies as like a business proposition. They found out they could save money if doulas were in the mix, and there's a less likelihood of cesarean sections and higher chance of birth satisfaction rates, right, with doulas. So all of those things, the data shows that those things happen with doula services. But at the same time, I don't feel like it was an accident that there are now a higher rate of inductions, right? And so inductions are forcing the body to do something that they're not ready to do yet. And the higher rate of inductions is a higher chance of C-section. And a higher chance of C-section is then a higher chance of morbidity or mortality. Do you know what I mean? So I don't think that was an accident. It all plays into the money part.
How do you, so this is how you're seeing this disparity manifest itself, right? And even as a result of advocating for a service to be protected for expecting mothers. Any other examples you can share with us on how these disparities manifest in your work and what you do to try to bridge that gap?
So the services that we provide at UPEC, or Urban Perinatal Education Center, Anna mentioned that the folks don't see the provider for like the first 10 weeks or so, like right after they get pregnant. So they can come to us. We have our Easy Access Care Model Clinic. So what that is a gap filler. So we see them when they first find out they're pregnant. We can confirm pregnancy. They can listen to the baby's heartbeat. We can talk about nutrition, talk about how they feel about the pregnancy, because not everybody is excited or happy. Some people are stressed out, and some people just need to cry, right? They need somebody to talk to. And then after baby's born, they need to wait another maybe 6 weeks for mom to see somebody. And so they can come to the Easy Access Model Care Clinic that we have. We can weigh the baby for them, make sure that breastfeeding is going well, make sure their mental health is okay. And we can also check their blood pressure and make sure that there's no type of postpartum eclampsia going on. And if there is, we can refer them to their care provider sooner rather than later. So that's something that we're doing. We also have free childbirth education classes. We provide those Tuesday night, Friday night, Saturday night, 5 p.m., 7 p.m., 7 p.m. to 9 p.m. It's free to the public. Everybody's welcome. The birthing person can bring whoever they want. We also have the first Rhode Island depository and dispensary of human milk. So that right there is also super exciting.
You are an entire education center bringing awareness to so many families. You were sharing with me off camera a recent experience where a grandmom and a mom came, and after having had 5 children, they were just in awe of the information that they were learning from just being part of a birthing class.
Right.
Talk to us about how important it is to have access to resources like that for birthing people.
It's incredible. So many of our families, especially the ones that do the 5-class series. So we have pregnancy class, we have a birth class, postpartum, lactation, breastfeeding, and then newborn care. They can take one class or all 5 classes, and the more information they get, the more empowered they feel, so that they can make those choices and advocate for themselves and their families to make the best decision for everybody. And it's just, when they leave, well, most times they don't want to leave. So they come to the class, and yeah, we're there for sometimes half hour, 45 minutes, an hour after class is over, and they love the information.
Next, we tackled another systemic issue, police corruption in the high-profile Karen Reed trial that took place in Canton, Massachusetts. Here's a look back. He was a notable witness during the trial, Trooper Michael Proctor. He came under fire for inappropriate text between him and other cops, but also his superiors. A lot of these texts went unchecked by those around him, ultimately leading to him being relieved of duty. During your years on the force, did you see a lot of this happen?
This was unique in and of itself, the type of communication, the vulgarity that was being utilized during a formal investigation where the lead investigator is making these very inappropriate and provocative statements. The misconduct that I saw within my career was usually checked by other troopers, that you would step in, you would intervene, you'd pull someone aside and say, you're out of bounds, correct your behavior. And that was the benefit, where if you cared about your colleagues, you cared about your career, you would speak up and not let things get out of hand. That didn't happen in this case.
Since the murder of George Floyd, many people have realized that there might be a systemic issue when it comes to the police system, specifically with targeting Black and brown men and women. In Massachusetts, just a few years ago, soon after the murder of George Floyd, an act relative to justice, equity, and accountability in law enforcement was passed in the Commonwealth, officially ending qualified immunity. Can you talk to us about the laws that are in place in Massachusetts and Rhode Island
Is that the right response? Do we need more? I know you mentioned off camera also the Brady bill, which is in question with Trooper Proctor's duty hearing.
So unfortunately, several vocations and several occupations have some type of misconduct. I think about Larry Nasser, the medical doctor involved with the Olympic athletes and gymnastic athletes. I think about the Jerry Skandusky scandal at Penn State, a coach responsible for sexual misconduct. And unfortunately, within the police ranks, you have that same similar type of misconduct. Regarding the aspect of qualified immunity, typically qualified immunity is extended towards government officials that in the performance of their duties, the decision-making process, they have some level of protection. Well, when you have misconduct over and over again, the question comes up, should they be protected with qualified immunity for a wrongdoing and misconduct and corruption? So here in Massachusetts, our police officer standards and training is a state entity that monitors and is the reporting agency for any police misconduct. And the Brady bill is the actual list. The Brady list is actually where those names appear. The Brady list is also responsible for tracking government officials that are elected officials, not just police officers, of any wrongdoing and misconduct. So I believe that the legislature has made moves to try to bring a level of accountability, greater accountability to government officials, whether they're elected or whether they're sworn duty officers. Another change within Massachusetts is police officers under their oath of office are also licensed. And what was happening is that if a police officer had a misconduct within their agency, they were allowed to retire early on, and then they would end up getting a job in another municipality or another government agency in the form of a public safety officer. The Brady list tracks that, and the post also, police officers in standards training also tracks that and holds that individual accountable so that they will not be able to retire and then appear in another uniform within another department.
And finally, we want to share the heartbeat of culture and storytelling. This season, we celebrated the Black storytellers who are preserving the past and helping to shape the future.
You define Fundafest as a celebration of Black storytelling. Talk to us about that.
Well, that's, it's interesting. Two thoughts go in my head. One is, wow, what an interesting question to answer in 2024, post 2020 in a way, and yet it goes on and on, right? So we've always been really clear that other people are putting our stories out in ways that don't always make us look good. And oftentimes we ourselves get caught up in the trauma stories of what it means to be Black in this world. And those are very important stories. However, we also, again, want to show the breadth of our experience, and we want to celebrate all of who we are. Like, first and foremost, this is a place for us to, kind of lay out the table, a smorgasbord of our experience and who we are. And that's a celebration. And, for 26 years, that's been the idea. This is celebrating us. We want people to always feel uplifted. We want them to feel inspired. We want them to learn something. They might go, ooh, and it's for everybody.
Right. And I love that it's through so many different, you tell the story in so many different ways.
Right.
You talk about storytelling through films, storytelling through poetry, spoken word, or maybe even just a song or a performance.
We have dance. We have Miss Melody Thompson and the Worship Arts, our Restoration Collaborative coming in, and they're going to be doing some dancing to sort of, it's a sacred storytelling event, one of our sort of most sacred events. We get together, and a lot of the elders of the community are coming out to see you bring about and present this idea of the sacredness of stories. And that idea that ritual And so we really, again, I have to shout out Water Fires for letting us literally borrow their fires.
Marlon's like, this is what storytelling is. It's like, come on, we gather at the fire. We've done it from the earliest days.
And you bring that with you everywhere you go through your education program. As I mentioned, through my own experience with my son coming home from school and being so excited that he experienced something different, that he learned something different. And that joy in storytelling got all the way into my living room, which I find to be a privilege. Tell us about your education outreach program and what your goals are as you expand.
So when we first started our festival, we had 3 storytelling performances in one school. This year, between January and February, at this moment, we have 70 performances booked all across the state of Rhode Island.
That's wonderful.
I used to work on a festival, the Johnny Cake Storytelling Festival, which was a lovely festival in South County at the end of September every year. And it was always frustrating for me because you know how Rhode Islanders are? They're not traveling to South County if they live up here in Providence or Pawtucket or, they're not going.
Not unless we're packing a lunch.
And rent, exactly. And even then, why are they going to go? So it became really important when we founded our festival to make sure that we got into the schools in our communities as well. Many of us work outside of the state of Rhode Island if we want to get paid. So this became the opportunity for us to get monies together so that we could, support our artists and get into the schools in our community so that Black kids would see themselves and that kids who were not Black would be able to learn something.
Absolutely.
So that's been intentional from the beginning. And for the past couple of years, through the Rhode Island Department of Education and their all-course network, we've begun a Funda Story Camp. So we work with kids during February vacation, during April vacation, and also during the summer vacations. So they get to come and they get to work with artists and they learn storytelling, they learn dance, they learn African drumming, they do visual arts, and
it's wonderful.
It's again, it's very exciting to see how that's been growing over the last couple of years.
As we look back and reflect, we are excited to also look ahead to a new season of stories that serve our diverse communities in meaningful ways. With that in mind, as you travel around Providence, many of you may be familiar with the amazing murals that celebrate diversity and inclusion. I recently had the good fortune to go on a walking tour with the Avenue Concepts Board Chair, Jamie Coelho, who shared the history of these inspirational murals and their lasting impact on our community. Let's take a look. It is gallery night in Providence. I'm here with Jamie Coelho from the Avenue Concept. It's great to see you again. And she's going to take us on a guided walking tour on this beautiful, cold winter night to show us the art across downtown.
Yeah, we're going to be outside, so I hope you're bundled up. It's a little chilly. But tonight is gallery night, and there will be trolleys going from gallery to gallery. But in between that, we're going to see a lot of public artwork, from murals to sculptures from many different national and international artists, as well as local artists. So I'm excited to show you in an illumination on Matthewson Street, and we'll hit up Grants Block and some other places.
I love it. I can't wait.
So you ready?
Let's go.
Let's go. Okay. This mural is a statement on unrequited love. Does anyone know what that feels like? Love someone, maybe they don't love it the same way back. I know I have felt that in the past, and I'm sure some of you have too. So I think we can all relate to this whole statement of what that feels like in this mural. And the model is actually one of our project managers for the Avenue Concept. It's a little unknown fact. Nick Plazer, that's how you name it, say his name. He's wonderful. And he actually is involved with the Avenue Concept by helping to curate the artists for these murals. So he goes out and seeks them out and does the research and then finds ways to get them to come here to complete their artwork. And the Avenue concept guides the artist throughout the entire process, from securing the walls to making sure it's prepped and to make sure that the artist has everything they need to do the work.
All right. So this one is called Creativity, Equity, and Justice, and it is by Shepard Fairey, who is the founder of the brand Obey. He's also a street artist, as you can see. It's a portrait of Angel Newman, who is a co-director of AS220. Our relation as the Avenue concept and how we were able to work in partnership with AS220 is one of our artists, Greg Peniston, who also did the mural on the Trader Joe's, came in and helped restore this work. So as you can see, it's looking pretty clean, bright and new, and typically murals that are 5 years old will not look this vibrant still. Sometimes you'll see some chipping. So yeah, we went in there, or Greg went in there and touched it up a bit. Can anyone read what's up in the right-hand top corner?
Creativity is the mechanism of self-liberation.
That's right. Creativity is the mechanism of self-liberation.
So thank you so much for being part of the liberating process, aka art process, aka creativity. And we have a little bit of a token of appreciation right before we walk over to Grant's Block, which is just going to hook right around the corner. These are just our postcard packs, if you can just take one. And a little bit of like what is 3 Nights of Lights, as well as our collaboration with Gallery Night. And just our, just a little bit more about who we are. And, you know, donations are certainly a way that we can continue to make our work happen. And so we ask you to support, do anything that you can. Being part of here is also a great way. Thank you, everybody.
So they're out tonight.
Yeah, they should be out tonight, I'm pretty sure, with the Illuminated Avenue. Participating. Andrew Holinsky is a digital artist. He's a professor, he's a music artist, has been working with us over the last couple of years to map a bunch of the Avenue concept murals. So for these lighting events, there's a technology that's blowing up all over the world where artists can essentially, like a green screen where they put the suits on and they put all the little points on you and then they can do really crazy animated things. They do that on our murals and they can essentially bring the murals to life. So Andrew has been doing a lot of playing with that with us, and this is an opportunity of bringing these light tubes that he builds in his studio. He works with a group also called Reliquarium that you're going to see down below. They take their sculptures, they're a Providence-based collective that take their sculptures all over the world. But that's it, so I'm going to walk you back to the graduate. Thank you all. I hope this was fun. Would you do it again?
Yes!
Awesome. Great. Thank you so much.
Thank you for joining us. Good night.